And welcome to Health Chat with Dr. T. Colon cancer. Last week I kind of started on what we need to do to prevent or to reduce the risk of colon cancer being the third most common cancer worldwide. So today I'm going to be talking about what testing or screening for colon cancer entails, and this can be done in different ways. I'm going to talk about the invasive and the non-invasive methods. I think we should start with the non-invasive methods. So one of the ways we can check for colon cancer is to do stool tests. So we take a sample of the stool or the poop or your feces. I know it's not cool, but we get the sample and we check for blood. This blood is often not visible to the naked eyes, and therefore we need to do special testing to find out whether or not there is blood in your stool. These tests are usually done after the age of 50 or after the age of 45, depending on where you live. Now, two types of stool tests that can be used to test for colon cancer is what is called the fecal occult blood test, which is not very popular but can be used, and there's another one called the fecal immunochemical test, which is what is used in my area of practice. So usually the patient drops off a sample and it is tested, and it should either come back positive or negative for blood. A positive test will warrant for that investigation to rule out colon cancer. Another test that can be done to screen for colon cancer, which is also non-invasive, is what is called a virtual colonoscopy or a CT colonography. This is a test like a CT scan where we take different views of the colon to see if there's any abnormality like precancerous lesions that can again now be investigated further. A test which I would say is actually quite obsolete is called the barium enema. The detection rate of polyps is a lot lower when we compare it to the other non-invasive tests. So in this test, a liquid with barium is actually put through the back end of the patient, and a series of x-rays are taken, and these x-rays are now read to see if there's anything abnormal. Now we're going to move on to another stool test that I actually forgot, is the stool DNA testing. So what happens is you drop off a stool sample and they do like a DNA analysis to see if there's any cancer causing or cancer related DNA changes in the stool, which again will prompt more testing. I'll go on to the next test, which is I'll call the gold standard for screening for bowel cancer, and this gold standard test is called the colonoscopy. Now, my patients have told me that the preparation of for the test is actually worse than the test itself, and that's because you need to have a clean large bowel to be able to carry out the test. The test involves using a little camera with a light at the end and through a little tube that is passed through the back end to have a direct look at the lining of the large bowels or the colon. And during the process, if there's any abnormal growths or polyps, samples can be taken and this can be assessed in the lab. So in summary, today I've shared with you different ways that we can screen for colon cancer. We need to screen for colon cancer because most times it is diagnosed late and treatment options can be limited. So patients over the age of 50 where I work, it could be earlier, in other areas, should be tested for bowel cancer by using this different screening test. I've talked about the non-invasive testing and also the gold standard test, which is the colonoscopy. So until our next episode, my name is Dr. Itope Roberts. My passion is to help you become better versions of yourselves by promoting your physical, mental, and psychological well-being. I hope you share this video with your friends, and if you're interested in what I'm sharing, feel free to follow, to like, and to share. Have a wonderful weekend.